Today on Conversations with VIE, we're going to talk about our 5-step approach to identifying cost savings, to achieving cost savings, and Rich and I are going to go through our steps and some examples.
First step is the contract review. First, obtaining all contracts, addendums, and then the review, making sure that you have price files, all the language, all the parameters within the contract, specifically the penalties, the commitments, and the incentives.
And it's really interesting because we take a deep review of contracts. So we just don't run to the end of the agreement and look at the appendix, look at the pricing at the last couple of pages. We do a thorough review of all of the contract terms from page 1 to whether it's page 110 or how many pages in between, because in many cases, not just purchase services, within even supply contracts and PPIs, there are terms in the agreements that have financial implications and obligations to a hospital. I'll give you a great example. We had a hospital who was utilizing a provider for educational books for their patient. And so it was interesting, like right in the middle of the contract, they were doing a pilot, and the pilot program had listed certain services to be included, but the language said that they had a minimum, and the minimum usage would happen outside of the pilot. But when we asked the frontline users about the pilot and what specialties were included in that pilot, that was about 80% of their spend, and they thought they would never be able to make up the minimum requirement outside of the pilot, and which would have meant another $100,000 they would have had to pay. So just by looking at that review and changing the wording from the pilot program to include all of the utilization, saved the hospital $100,000. So we absolutely are dedicated to those contract reviews because a lot of those clauses have a financial obligation to hospitals.
And that leads right into number 2, which is comparing the contract to the invoices. And what we do, and what we've been doing since 1999, is take 12 to 18 months worth of invoices, put them in Excel, and match them up to the contract. Now we have a technology which helps us and helps our clients move this process along a lot faster. And what it does is identify any issues with on contract, but the pricing is incorrect, and a lot of times off contract items.
And a lot of times those items that are off contract have a significant impact to a hospital, and many times they wouldn't even know that if they didn't have that visibility.
Right, absolutely. And that leads right into number 3, which is the optimization and the utilization. What are the trends? What are they utilizing? Really, a lot of times what we see is 12 months. Let's take 12-month utilization report and then benchmark, negotiate. But really, a lot of times what we find is that you need to compare not only the 12 months, but maybe the last 1 month or 3 months worth of invoices and line item details. Really, that shows you, like Wayne Gretzky says, where the puck is going, not where it is now.
Absolutely, and so sometimes a 12-month utilization is very different from the last 3 months. You'll see interesting trends pop up in those last 3 to 4 months, and then we kind of make the inquiry to the hospital, like we see something different going on, and they'll say, oh yeah, we just brought a new doctor on, or something new just happened, and we were able to identify that by honing in on the last 3 to 4 months of spend.
This goes right into number 4, which is the discussions with the end users. We walk in with the data from the contract, from the invoice reconciliation, from the utilization and the optimization, and then have our conversations, and we're able to understand, 1, is there anything that we're missing? 2, is there anything that there's going to be anticipated coming down the road? And then any other feedback they could give us.
Frontline insights and really being able to engage the frontline users and see what's going on is very, very important in this process. And so we had a health system that asked us to look at their EVS agreement, looking at benchmarking. So of course we're going to look at the agreement, we're going to analyze the details, we're going to benchmark. But as we were speaking to different people in the hospital, we were speaking to the OR, and the OR was saying that they had to hire people to help turn over the rooms, help clean the rooms, yet in the contract it was the provider that was their responsibility, was to do the OR cleaning and to turn over the rooms. So what that led us to was to be able to get a significant credit for the hospital, because the hospital was supplementing or actually providing those services, and they should have been. It should have been the EVS provider. So those frontline conversations, the frontline insights, and the walkthroughs sometimes can add tremendous value on these cost savings initiatives.
And that leads right into the last part. Now we know the contract details, we know the invoice, we know if there's any discrepancies, we know where the utilization, where the trends are going, and we've talked to the frontline users. Now we benchmark. A lot of companies go right to benchmarking and negotiation without doing all those steps beforehand, and they leave a lot of money on the table. So what we do, again, benchmark and then negotiation. Put the strategy together based on all of the information that we've collected.
Right, so just to recap, right, number one, we're going to analyze the contract in depth. Number two, we're going to perform a reconciliation of the last 12 to 18 months of invoices to the agreements. Number three, we're going to look at optimization and utilization and look at all those trends for opportunities. Number four, we're going to speak to the frontline users and sometimes take that assessment and walk through. And number five, we're going to benchmark and really be able to provide hospitals with the best pricing that they can achieve, and as well as execute and have a negotiation strategy. And I'm going to throw in number six. After that's all done and you have a contract in place, you can't just put the contract in, in your file drawer or in a contract management system. You've got to measure and you've got to track and you've got to make sure that you're achieving those savings and have a system in place to monitor. Otherwise, you're going to be doing these initiatives every 2 or 3 years. VIE's 5-step strategic approach to cost savings is industry leading, and it's different from anything that you'll experience in the marketplace. And Rich and I would love to have a conversation with you about how we can deliver cost savings and margin improvement for your hospital.